I'm Glenn McGuinness, and welcome to Outburst. This week, healthcare in Canada.
Probably better service, like just being able to get in sooner for procedures.
We know that we need more doctors, more hospitals, and the wait list and all shouldn't be that much huge.
I've been sick all week and it's impossible to get help, especially here in Fredericton.
We have got to take healthcare the next mile, which I believe should include dental health, mental health, drug care.
Mental health is a major issue in everyone's life.
Maybe like some more doctors. Maybe that's the issue. Maybe it's just the time of the wait that is so long.
In this show, we examine the healthcare crisis from all sides, particularly how patients are experiencing the healthcare system.
Today we're here because of the health care. People are dying in Cape Breton left and right. Nobody's standing up for them. People are trying to speak, but nobody's listening. And more people need to stand up.
In Nova Scotia as a whole, Cape Breton included.
Yeah.
Not just the mainland, it comes to Cape Breton too.
Yeah,
that's right. We have a lot of the senior population here. They deserve better. We all deserve better.
My children don't know what it was like to have a doctor. You sit in outpatients, they wait for hours, bouncing around, call 811. I mean, it's crazy. It's third world healthcare in a first world country.
On December 30th, I visited and merged with my wife because she was very ill. We came here at 2 p.m. About 2:30, a gentleman comes in with his hand in a gauze, and his index finger was cut off, and it was in a Sobeys bag and baggie inside. And at 11 o'clock that night, I finally got called into the room, the back room, to see a doctor with my wife, and he was still out there. And at 10 to 12, that man finally got in to a room with his finger in a bag, and he told me at that time that his finger is gone, they're just going to sew him up now. So somebody with their finger cut off for 10 and a half hours in a waiting room is not right.
For us to have second and third world health care here, when we have a country that's supposed to be the greatest in the world, I'd like him to tell me that. The reality is, in 1997, I was fortunate enough to be elected, to go to Ottawa and stand up for this place that I love. And one of the reasons I did was because doctors were rallying, because people were dying because of health care. And here we are 20-some years later, and nothing's changed. And I want to know why. And what is Justin Trudeau going to do for that?
So Canadians have many questions about healthcare in Canada, and here to help us answer some of them is Pam Damoff, who's the Parliamentary Secretary to the Minister of Health, and also the Liberal MP for Oakville North Burlington, correct?
That's right, yeah.
Pam, thanks for joining us. First, before we get started, I just wanted to ask you about the video we just watched out of Cape Breton. What are your thoughts on that?
Well, I know healthcare is one of those issues that Canadians are passionate about, as they should be. We take a lot of pride in our healthcare system, but it's troubling when you see videos like that. It really is. No one should be sitting for that long in a waiting room. I think the part that gets a little bit muddy is who has jurisdiction over it. So the federal government provides a large chunk of federal funding for healthcare, but it's up to each province to decide how they're going to deliver it. And we leave it up to the provinces to determine what their local priorities are, and everything that they were talking about in those videos are all things that are determined provincially, not federally. So we don't invest specifically in a hospital to reduce wait times, for example.
So we have a few questions, and let's get right to our first one.
Why is the wait time so long for mental health care, psychologists, psychiatrists, even just basic community programming revolving around mental health?
So the answer to that is we haven't made it a priority, and we are now. The federal government invested $5 billion into mental health and signed bilateral agreements, again, with the provinces for them to be able to deliver enhanced mental health services locally. But we do need to make it a priority. It's encouraging to see a young person asking that question, because I think with pressure from them, you will start to see provincial governments putting more resources into mental health.
Okay, and here's our next question.
I'd like to ask the federal government what they're doing about the number of doctors and the shortage that we have in Canada.
So again, provincial. Certainly it's a concern I hear as well, not so much in my community, but more in rural and remote communities where they're trying to get more doctors. And I think in Nova Scotia, the provincial government has just introduced a plan to try and encourage doctors to get into some communities, but that's something that the provinces do right across the country, provinces and territories.
Mm-hmm. Now, speaking of the provinces, our next question has to do with consistency in healthcare with the province.
My question to the federal government is that what is the federal government doing in terms of getting all the provinces to agree on what it means to be essential as far as healthcare is concerned? Because right now we have a situation where each province gets to decide what's essential in terms of delivery of healthcare.
Good question again, and I think that's where you have the Minister of Health meeting with her counterparts across the country to try and let them know what our priorities are federally, and hoping that they can come to an agreement. Mental health was one where they all did agree that it was a priority right across the country. So I think those are the kind of things that you see us doing, where the Minister is meeting, as well as the Prime Minister meets with premiers and healthcare is certainly something that would come up.
Okay.
Right now I'm under 25 years old. I take medication, but I'm concerned that when I do hit 25, that I'm not going to be able to afford them, and I just want to know how I'm going to be able to.
And her question, I think that must be coming from Ontario, because the
That's from here in Ottawa, yeah.
Yeah, so the Ontario government just cut funding for PHARMACARE for people under 25. In our recent budget, we did implement a number of steps that will bring us towards national PHARMACARE, but specifically to her question, that's again a provincial responsibility. We're trying to step in and develop a national PHARMACARE program that would alleviate her concerns.
Now here's another one on the topic of mental health.
I would like to know specifically what the plans are for the $25 million investment in suicide prevention in Canada. We know that there's been some effort. There's been effort on behalf of the Mental Health Commission of Canada, Crisis Services Canada, to actually address the suicide problem that we have in this country. You know, middle-aged men are dying at astronomical rates. It's the second leading cause of death among young people, young boys, and men especially. So I would like to know specifically what the plans are to reduce and ideally eliminate suicide in Canada, because we know that suicide prevention is not only possible, it's actually likely when we do the things that we know work.
And he mentioned the money that was in the budget around suicide prevention and developing a hotline across the country. I'm going to give you another answer that probably you're not expecting is our firearms legislation. 80% of people who die by suicide are using a firearm. So restricting the ability to obtain firearms will reduce the amount of people who are successful when they die by suicide.
Well, Pam Damoff, I want to thank you very much
You're
for
welcome.
being with us today.
You're welcome.
And
I thought there was another question coming.
No, that's all we have for you, but good luck to you and thanks again.
Thank you.
How would you change Canada's healthcare system?
First of all, I think it's great. I mean, it's okay that, you know, when you can go through the hospital with no fear that you should pay for something and all, but there's the less amount of doctors and, you know, hospitals and all that I think it's not that enough for this amount of people. We know that we need more doctors, more hospitals, and, you know, the wait list and all shouldn't be that much huge. So this is the things I think we have to take care about it.
Probably better service, like just being able to get in sooner for procedures. Right now it takes an awfully long time. I know the U.S., you have to pay for everything, but you can get in very quick. And here, you have to wait quite a while, so that'd probably be it.
I'd like to see a drug plan, actually, for everyone, so that, you know, the same as healthcare right now, we could have a drug plan for everyone.
Yeah, maybe like some more doctors. Maybe that's the issue. Maybe it's just the time of the wait that is so long.
Honestly, I feel like we have a good healthcare system. If you look at the U.S., the way that the U.S. works, they have to pay for the healthcare, everything. Over here, with the way our taxes are and everything, we don't have to pay anything. We have the Medicare system. Honestly, I wouldn't change anything.
I think the biggest thing is making sure it's affordable for everyone. I think as Canadians, we really pride ourselves in making sure that we have affordable healthcare for everyone, and right now it's not necessarily the case for everyone. So I think just to continue to have that pride and make things available for everyone.
From the Quebec side, having access to either a nurse or a clinic is often challenging because of either we're not a client of any of the doctors of that clinic, and in which case we're not even able to access the clinic.
Oh, you have no idea how emotional this is for me today. I have 2 daughters that both have found lumps in their breasts. One had an MRI today and is going to have to wait 7 days or 2 weeks for results. I think we need some improvement there. We need to implement a PHARMACARE right across Canada. If we're going to improve anything, it has to be fair for all people. Like my sister mentioned here, with the we can't have tiers of health care. It should be consistent for all. It should be affordable for all. The wait times that are happening within surgeries and for MRIs, it's unacceptable, completely unacceptable.
A recent analysis titled the Global Health Index has been released, and it ranks Canada the healthiest among 151 countries surveyed. Canada has always aspired to be a socially progressive nation, which includes global health, decreasing preventable deaths in developing countries. But some say Canada has taken a step back from broadening its global health agenda. So we took to the streets to ask Canadians their thoughts on Canada's role in the wellness of the world. What is Canada's role in promoting global health?
I don't know if Canada has a role, a formal role, but maybe I think that Canadian people is very healthy. If you compare with other, for example, Latin America or North America, the States, people here is more willing to do exercise, to eat well. So maybe Canada could be like an example, a role model for other countries.
Yeah, we do have a role, honestly, because if you look at the third world countries and everything, I feel like they look up to us, Canada, and the way that that our healthcare system works. And I feel like countries want to be like us in the future. So
I believe that we do. I mean, we're all trying to have a better world here, so let's just help each other.
Well, I think Canada is a leader on health services to the citizens, and we have a coast-to-coast health services, healthcare. So I think we have a role as a promoter. Even with rich countries, sometimes we don't understand that everybody should have access to free medical services. So I think that, and maybe we could help also by providing I imagine we have a good expertise in that field, so maybe share our expertise with those countries.
Well, I think Canada needs to support UN. We need to be an active participant in identifying where we can assist, providing the kind of expertise and resources that we can contribute to developing countries. Developing countries are challenged on a number of fronts. I think if we build sort of a strategy around the economic development of those countries, we'll see some of those problems disappear. I think we have to, support education first, and I think that's part of the strategy.
When was federal Medicare legislation passed in Canada?
I don't have a guess.
Come on, give me a guess.
I want to say in the 60s. 64?
1970.
I'm going to say 71.
1992. Your choices are 1960, 1966, or 1972.
I know it's Tommy Douglas.
I'll go 1960, the 1960 option.
1960.
I'll say 66 because it's in the middle.
It's 1966.
Oh, there we go.
Let's have a handshake.
Thank you.
Very good.
Thank you.
Thank you. Saskatchewan is known as the birthplace of Medicare in Canada. Shortly after being elected in 1944, Saskatchewan's CCF government, under Premier Tommy Douglas, began full funding for treatment of mental illness, cancer, and STDs. By 1946, comprehensive hospitalization coverage for every resident of the province was introduced. In 1964, the Hall Commission report was presented to Parliament, which helped establish the foundation of a national Medicare system in Canada. Universal Medicare legislation was finally passed on the federal level in December of 1966. It became effective in 1968 and was fully implemented in all provinces by 1972. Canada holds the distinction of being the only nation in the world with a public health care plan which does not include prescription drug coverage. As recently as 2016, Canadians spent roughly $30 billion to fill 600 million prescriptions. Well, recently we spoke with Leo Broderick from the Council of Canadians about how his organization wants to see the inclusion of prescription drug coverage in Canada.
The Council of Canadians has been doing research on why we need a national public pharmacare program for many years. And we have been in touch with many Canadians, and in our research we have found that 91% of Canadians want a national public pharmacare program for many reasons. Well, pharmacare means at the moment that across this country there are over 100,000 drug plans, private. There are at least 100 public drug plans, but 25% of Canadians can't afford drugs, and 10% of Canadians don't have any drug coverage whatsoever. So the Council of Canadians has been advocating for a universal public pharmacare for many years. If we had a universal public pharmacare program, it would impact the economy greatly. At the moment, of course, with our Canada Health coverage, it does lower labor costs by 4%. So we're expecting that if there was a universal public pharmacare program, labor costs and would be reduced as well. So it will impact the economy greatly.
My name is Samuel Breau, and I'm a mental health advocate. I live with a generalized anxiety disorder, and this is my story. I started to become aware that I may be living with a mental illness when I moved from my hometown to start university. And the sudden change of community, the increased pressure of attending university, as well as scholarships, all of that changed my world, I guess. And that's when I started noticing that my mood was changing, my outlook on life was becoming hopeless. And I realized that there was maybe something that I needed to look into. When I was young, I did not know or have the language to explain what was happening, but eventually I figured out that I was gay. I also, looking back, suspect that I was living with a generalized anxiety disorder throughout that time. And being in a small town, being gay, did not make things easy for me. Stigma has decreased significantly in the last 20 years, but there's still a lot of work to be done and room for improvement. I think mental health and mental illness are still not on the same footing as physical health, both in how it's funded in healthcare services, how people are received in emergency care if they're experiencing thoughts of suicide. Unfortunately, I think that lack of awareness has led to the worst case scenarios where people end up losing their lives to suicide or other problematic behaviors. And that's not their fault. It just people have not been aware or taught how to deal with these things. The support of my husband in maintaining really good mental health as I live with a mental illness has really been instrumental. When my mood or mental health starts changing, my husband can call me out on it. So it's really been helpful to have someone that's able to support what I need to do to stay mentally healthy. If someone's in crisis or in a really tough spot where they feel like they're running out of options or they're about to make a bad decision, I would just want to convey that it's okay to feel the way that you are feeling right now, and to just sit there maybe for that evening or for that hour, and to trust that it can pass, but that the hopelessness or that feeling is part of the mental illness. So that moment will pass. It might feel like it's the end of the world in that moment, but it will pass. And to understand that it's okay to not be okay, and that in fact it's really normal.
Should access to mental health care be available to Canadians as part of public health care?
Yes, I absolutely believe that we need a greater recognition of mental health in this country, and anything to improve on that topic is a good thing.
I think it should, because I personally suffer chronic depression, and I know how difficult it can be, especially when it's really, really bad.
Absolutely. Yeah, I think that we have got to take healthcare the next mile, which I believe should include dental health, mental health, drug care. I think European model is working fairly well, like the Danes and the Swedes and those people. I think we have to take it the extra mile, not go the other way, which is privatization and the American model. It just doesn't work for me.
Government has a role in that, but I think other institutions have a role in it as well. Government can't do everything for people. We need to kind of look out for ourselves as well somehow.
I think mental health is a very important thing right now. It's always been an important thing, but I think now that there's more focus to it, I think that it should be expanded upon as part of what we currently have.
When things like the economy are having a hard time, people's mental health really does suffer, especially as they maybe lose some parts of their identity that were attached to things like jobs, and were attached to things the way that things used to be. So I think mental health is going to be only an increasing concern, especially as we gain more awareness around the different ways that mental illness kind of affects everyone differently and can affect a whole community, not just an individual. So it's absolutely essential that it's part of public health care because it affects the public.
You can see a broken leg, and therefore you think about treating it, but you can't really see mental health illnesses and issues. So many people have them, and they're every bit as debilitating as physical injuries. So yes, I believe so.
Yeah, should be included because, for example, I'm optometrist, but an Uber driver part-time. So sometimes I pick up some people with a mental health. They didn't receive the correct attention. This is a concern to the whole Canadians, not just the people they have the issue, but the whole Canadians, they have to be safe.
I think there should be access to some service, but I don't think it's entirely incumbent on the government to provide those services to Canadians.
Why?
Well, I think you can provide services to Canadians, but at the end of the day, it's up to the individual to take care of themselves to a certain extent.
Canada has long had a public health care system, which means the majority of hospital visits result in little to no cost to the patient whatsoever. Private health care has long been a controversial topic. Some feel it throws off the balance of our health care system. Under federal law, it is illegal for a private health care clinic to provide services covered under the Canada Health Act. So, we took this question to Canadians. Do you think there should be access to public and private health care in Canada?
I feel that that's a choice maybe we should be able to make.
I don't want to see it go the way of the only really good care is being paid for. But I do believe we should have that choice.
I think there should be some access to private healthcare, just to take some strain off the public system. As long as the public system doesn't get shortchanged in the whole pot of money available. So I don't support private clinics with public funds, but I do support if private clinics, if somebody wants to go and pay by themselves, by all means you can do that.
We need a two-level system. We need a two-tier system where, I don't want to go to emergency for, a sore back, but it would be lovely, and I can't get into my doctor's office, so it would be lovely to have a system where I could, I'd be willing to pay, a fair amount if it means that I could get access to care when I need it.
Yeah, I think with the wait times that we're experiencing here in New Brunswick, second tier of medical system might be a little better. My time I spent in Alberta, it's awfully nice to get an MRI if you need one in a timely manner.
No, I don't think that private healthcare should be on deck in Canada.
And what do you think?
I think that there's evidence that it does not work in terms of having a two-tiered system. Doesn't actually speed things up in the public sector. It just takes funding away from the public sector. That's a huge issue. Health inequity is already a problem in Canada. Having a two-tiered health system does not fix that. Funding needs to be expanded for the services we already offer, and the services we offer need to be expanded into communities that are already underserved.
Yeah, I do believe so, yeah. That would be optimal. Right now, I went to the doctor, I broke my wrist a while back, went to the doctor and I waited way too long for that kind of stuff. So if people have money and they don't want to wait in line, that's a big thing.
I think there should be access to public health care.
And what about private health?
No, because it's a wedge, and it's a thin edge of a wedge that's going to start opening up.
I've been debating that in my own mind, and I think, yes, if it gives a chance for the people who can afford private health care, that they should go ahead and do so. And it may free up some of the other, I would say, less fortunate to receive health care, even though they're paying for it, but in a more timely manner.
I think there's a case to be made for both. I think as Canadians, we have a lot of flexibility. We have a lot of demographics in our country, and I think there needs to be a case for both. How that gets done and put in place is for people who have a lot larger pay scale than mine.
That's all for this episode of Outburst on the Cable Public Affairs channel. I'm Glenn McGuinness. If you have any comments or question ideas for this show, you can find us on social media. You can also find us on our website, www.cpac.ca/outburst. It's your turn to speak up, and we're listening.